Let's talk about neurofibromatosis.
Let's break down this terminology a bit. Neurofibromatosis. Neuro refers to nerves. Fibro refers to fibrous tissues. And oma refers to tumors or growths. Altogether, this medical terminology lets us know that this disease results in tumors or growths in the nervous tissues.
Neurofibromatosis is characterized by small raised bumps across the body, caveoli spots at the posterior end of the body, and discoloration in the iris. These characteristics usually appear in childhood.
NF2 can appear in adolescence or in a person's early 20s, or can occur at any age. The most common tumors with NF2 are bilateral acoustic schwannomas, which are tumors on the acoustic nerves which can lead to deafness. Juvenile cataracts are tumors developing on the optic nerve which can lead to partial or total blindness. Meningiomas are tumors on the meninges, which is the covering of the brain. Ependymomas are tumors of the CNS, which are the brain and the spinal cord. These are dangerous because they can travel through the CSF and spread throughout the entire central nervous system.
Fibromatosis type 1 is a heritable disease and can only be acquired through heritability. If one or both of the parents have it, then it could affect the child because it's an autosomal dominant inheritance disorder.
There are two ways to diagnose NF1. There are clinical diagnosis and there are genetic testings that can be done on the child. During clinical diagnosis, the doctor will be looking for symptoms of NF1 in the child's body, such as caveolus spots or neurofibromas. The advantages of a clinical diagnosis or a genetic test is that they're simple and somehow effective to diagnose if the child has NF1 or not. However, sometimes NF1 tends to show up as the child grows older, or their symptoms might not be definite enough to diagnose the child, and they could even misdiagnose a kid with NF1. Genetic tests are very useful because they tend to give a more secure answer if the child carries the NF1 change gene or not. However, they can give an inconclusive response to it if the child has mutations but shows no symptoms of the NF1 disease. Sometimes the clinical exams and the genetic tests can be inconclusive. In a case like that, it is recommended that the relatives of the patient are tested for it. There's a high probability that if one of your relatives has it, then this child will also have it.
There are two types of neurofibromatosis, both of which affect genes that code for tumor suppression. The first type of neurofibromatosis primarily affects the production of neurofibromin. The affected gene is found on chromosome 17 in position 11.2. NF1 involves roughly 250 base pairs and can easily develop mutations. This is why NF1 is far more common than NF2. Neurofibromin is the intracellular protein coded for by NF1 that controls cellular growth in nerve cells. With the mutation of NF1, the production of neurofibromin is greatly decreased on the cells. This allows for Schwann cells and oligodendrites in nervous tissues to continuously undergo mitotic processes. This results in tumoral growths in the nervous tissue. NF1 is generally characterized by these many small growths underneath the skin in the peripheral nervous system tissue. The majority of these tumors remain benign. The second type of neurofibromatosis primarily deals with the production of a protein called myelin, which is also referred to as neurofibromin 2. In NF2, the affected gene is found on chromosome 22, position 12.2. This gene involves only 46 base pairs, and spontaneous mutations in this gene are far less common as opposed to the mutations in NF1. The protein myelin links actin and nerve cell cytoplasm to glycoproteins on a nerve cell's surface. Glycoproteins are projections on nerve cells that aid in the control of mitotic processes, nerve cell response to growth factor, and additionally help with intracellular communication. The mutation of the NF2 gene causes a loss of production of myelin protein, or any myelin protein that is produced